Welcome back to The Explainer. So, today we're diving into something really big, a brand new study that's looking at AI, but not just any AI. We're talking about AI in medicine, probably one of the most complicated fields you can imagine. For years, this question has felt like something out of a sci-fi movie, right? Can an AI actually reason better than a doctor? It's been the ultimate benchmark. Well, it looks like we might have just gotten an answer. And honestly, it's pretty startling.
Because a new study is showing that the answer is yes. A resounding yes. Researchers have this new AI model. They're calling it GPT-5. And get this, it didn't just match human doctors on some really tough medical reasoning tests. It blew past them. We're talking superhuman level performance here.
All right, so let's get into the details of how an AI can actually surpass a human doctor. We're going to start with the big headline-grabbing finding, because this really changes the game. And the thing you've got to get about this is that we're not just talking about a tiny step forward. This isn't just a few percentage points better. The researchers themselves are calling it a qualitative shift. That's a huge deal. It means the AI's abilities have fundamentally changed, moving into a whole new category of performance.
So, how did they prove this? I mean, that's a pretty bold claim, right? Well, they didn't go easy on the AI. They put it through the ultimate medical exam, a series of tests that are incredibly tough, designed to mimic the exact way a real doctor thinks and diagnoses. And at the heart of this is a concept called multimodal reasoning. Now, that sounds technical, but it's actually really simple to understand. It's just the ability to look at different types of information at the same time and make sense of it all. Think about your doctor. They don't just look at your lab results, right? They listen to your story, they might look at an X-ray or a CT scan. They're putting all those pieces together. That's multimodal reasoning. And like I said, they threw the whole gauntlet at this AI. It had to face a whole bunch of official, high-stakes medical exams. We're talking things like the USMLE assessments, the big licensing exams, board-style questions, even radiology image quizzes. This isn't medical trivia. This is the real deal, the same stuff doctors have to pass to get their license. Okay, so now for the exciting part. Let's look at the results. Because when you see the numbers, you really start to understand just how massive this leap in performance actually is. So let's start with a baseline. This chart shows a really tough test, that MedExpert QA, which mixes text and images. And if you look at the previous model, GPT-4o, it's actually scoring below the human experts. I mean, it's close, but it's not quite there. It's good, but not better than a trained professional. Okay, but now watch this. When you add the new model, GPT-5, to the chart, wow. It doesn't just catch up, it blows right past the human experts. Look at that jump. It's up around 70%. That is a massive, massive difference. Just to put a number on it, that's more than a 24% improvement over the human experts. A 24-point jump. On a test this hard, that's not just an improvement, that is a staggering leap. It's the kind of thing you just don't see very often. And if we look at the raw numbers in the table, it tells the same story, just in more detail. You can see GPT-4o was actually behind humans on reasoning. That's the first column. But then you look at GPT-5, and it's not just ahead, it's way ahead. A commanding lead in both reasoning and in understanding the case. We're talking over 24% better on reasoning and almost 30% better on understanding. It's dominant across the board. Okay, so numbers are one thing, but what does this superhuman reasoning actually look like? How does an AI think through a medical case? Let's take a look at a real example from the study to see it in action. So this was a really tricky case. You've got a patient with a complex history, and you've got this CT scan. And GPT-5's rationale here is amazing. It hones right in on this combination of suprasternal crepitus and blood-streaked emesis after vomiting, and it connects those dots to diagnose a very specific, very dangerous condition called Behr syndrome. That's exactly the kind of connection a top-tier human doctor would make. And you can see its thought process laid out here. It's so logical. First, it pulls together all the info, the patient's history, the vitals. Then it analyzes the CT scan. It spots that one critical symptom, the crepitus. From there, it forms the diagnosis. And it doesn't stop there. It even recommends the correct next step, the specific test needed to confirm everything. It's a complete diagnostic process from start to finish.
So all of this is incredibly impressive, right? But it brings us to the really big question. What does this all mean for the future of medicine? Are we looking at a future where AI replaces doctors? Let's talk about that. Now, the researchers are really clear about this. On one hand, you have this incredible promise. Imagine an AI like this acting as a co-pilot for doctors, right? Helping them sort through mountains of data to find the right diagnosis faster. But on the other hand, we have to do a reality check. These were tests in the lab, not in a chaotic, real-world hospital. There are huge ethical and safety hurdles to clear before you could even think about deploying something like this with real patients. But even with those caveats, the study's conclusion is powerful. They're saying this marks a pivotal moment. That leap from almost as good as a human to clearly better than a human, that's a fundamental shift. It changes our whole understanding of what AI can do in medicine, at least on these specific benchmarks. And that really leaves us with a mind-bending question to think about, doesn't it? Yeah, these are just benchmarks for now, but this study forces us to ask, what does medicine look like when the most knowledgeable, most insightful expert in the room isn't a person at all? That's a future that might be getting here a lot faster than any of us thought.